Okay, so we're recording in Fort Myers, Florida. This is Dr. Scott Geller, laser floater guy. And we have a great patient here from Punta Gorda, Florida. You had an interesting situation. You had cataract surgery bilateral back in 2010 or so, correct? You had a YAG capsulotomy subsequent to that. And after the cataract surgery, you had intermittently blurred vision, correct?
Correct.
Did your doctor down there who did the cataracts mention why she thought that was happening?
No, just said everything looked fine to her.
Right. And you just left it at that, and you actually thought she somehow damaged the intraocular lens implant, which really wasn't the case. And you put up with this for a few years. What were your symptoms with that big floater in your visual axis?
Well, the worst symptom was at nighttime, the glare in the eye came back like I had when I had cataracts from headlights. The other symptoms it was like a window shade would be pulled down over the eye, and I was looking through an opaque piece of glass at everything.
And nobody ever made the proper diagnosis. But you read an article about me and went on the internet and said, I fit this profile.
Exactly.
But the interesting thing is I've seen many patients who've had cataract surgery. They develop what's called a posterior vitreous detachment, where the vitreous gel shifts away from the back part of the eye. Then you had large floater behind the intraocular lens, which was like a windshield wiper or window shade, and another opacity that was more lateral but could come in and out of your field of vision. We call that a hyaline opacity. It's on the surface of the gel. You had, what did I do, 4 laser sessions? 4 laser sessions?
Correct.
And where are you with it now? That's the question.
I would say 90% of the time it's 99% better.
That's all that counts. A lot of doctors want to see a double-blind, cross-controlled study, which of course is very scientific. But I've been doing this for many, many years, 15 to 20,000 laser sessions. We don't need to be that obsessive about numbers. We know what we can do. We know what works. We know what doesn't work.
Yeah.
Not every patient can have this done. But you're a great patient, and it's it's always good to get the victory. Thank you for being here.
Thank you. It's a great improvement over what I had going on.